Good evening, all. Myself, Dr. Rajesh Bajaria, Shriram Hospital, Powta branch, Jodhpur, working as a consulting physician, practicing diabetes and gastro specialty in Shriram Hospital, last from 8 years, completing MBBS from JLN Ajmer. After that, I'm MD from Dr. SNMC Jodhpur. Today's topic is feeling this stomach discomfort post medication. There are a lot of medications are there which can cause stomach discomfort or pain, like antibiotics, oral antibiotics, or IV antibiotics, NSAIDs, and many more drugs. While effective for various health conditions, this medication can cause unpleasant side effects. This discomfort can manifest as a how much nausea, heartburn, indigestion, and stomach cramps. The type of medication can cause this. These are the NSAIDs, including aspirin, ibuprofen, naproxen. They can irritate the stomach lining, increasing your risk of ulcer and inflammation. Antibiotics are there that it can disrupt the gut microbiota and leading to digestive issues. The type of medications and individual factors can influence the severity and nature of the stomach discomforts. These are the NSAIDs. Aspirin, ibuprofen, naproxen can cause irritation of the stomach lining and ulcers and inflammation. Antibiotics are a lot of antibiotics are there. They can disturb the gut microbiota and leading to digestive issues like diarrhea and bloating. Iron supplements are there. Iron is notorious for causing the constipation and stomach upset. Several studies are there can help to alleviate the stomach discomfort caused by medication. What are that? Take medication with food, acts as a buffer, protecting the stomach lining from the irritating effects of medication. Consider timings, like if instructions allow, take medication in the evening post dinner. Ask about alternatives. Discuss the potential side effects with your doctor. In some cases, alternative medications with low risk of stomach upset could be prescribed. Dehydration can worsen the stomach discomfort. Drink plenty of fluids throughout the day to stay well hydrated. Switch to a bland diet during times of stomach upset. This includes easily digestible foods like toast, rice, bananas. Over-the-counter medications like certain over-the-counter medication like antacids or histamine 2 H2 blockers can help to neutralize the stomach acid and relieve the heartburn or indigestion. Severity of discomfort. If the stomach discomfort is severe, persistent, or accompanied by other symptoms like vomiting, bloody stool, or black stools, consult your doctor immediately. These could be signs of more serious condition. If you experience stomach discomfort with every dose of a long-term medication, discuss alternate treatment options with your doctor. Do not self-medicate with over-the-counter medication unless recommended by your doctor. Always consult your doctor for personalized advice regarding medication, side effects, and management strategy. There are a lot of things we can do to avoid stomach discomfort, just like I do. I advise my patients to take medications with plenty of waters. Some medications can be given after food, and some medication can be taken without food. So we have to educate people or patients how to take medicines. Avoid spicy food, any other to avoid drug and drug interactions, to avoid stomach discomfort. There are some medications which increases the acid secretions. Should avoid it. There are some medications can be given to the patients to avoid stomach discomfort, like H2 blockers and proton pump inhibitors, and some antacids are there in our market to avoid stomach discomfort. But medications should be advised by a clinician. These are the common side effects which can drop out the patient's management. And at the time of consultation, should educate people to avoid dropouts for better treatment and management of the patient. Aspirin, very common drug, which is given in cardiac patients, but there are a lot of drugs are there, H2 blocker and PPI, that can cause drug and drug interactions. To avoid it, use H2 blockers and PPI with cautiously to avoid effectiveness, decrease effectiveness of the antiplatelet drugs. There are common drugs are there, NSAIDs, which are using for pain relief. Most common drugs are can cause irritation of the stomach lining is ibuprofen and naproxen, which are used in migraine, headaches, and any other as anti-inflammatory drugs or for antipyretic drugs. Some patients are very comfortable with these type of drugs. We can avoid H2 blockers and PPI of in that kind of patients. And some patients are very keen for these side effects. Should prescribe. Should ask about their hyperacidity and any previous history about these medications. So we should avoid, we can prevent these side effects after taking proper history. These drugs, ibuprofen, naproxen, painkillers, should avoid in gastric ulcers and duodenal ulcer patients, or if it is necessary, should be given with H2 blockers and proton pump inhibitors. What about antibiotics? Their common side effects are diarrhea and stomach discomfort, dyspepsia, and flatulence and abdominal distensions, gaseous distensions. We should avoid these side effects by prescribing H2 blockers and PPI and pre and probiotics. Iron supplements are very important. These are used for treatment of anemia. Anemia can be associated with any other conditions. Iron supplementations nowadays in form of ferrous ascorbate available. Ascorbate is better than any other preparations of iron with less side effects of constipations and stomach discomfort. We can avoid it. Timings is very important. Late night drugs should be avoided. Painkillers and any other drugs should be avoided because post dinner you can take, but it should be avoided during sleeping time because there is some gastric reflux is there in some patients. So you can use medications exactly post dinner or in evening time to avoid their side effects. Proper history is very important. Past history is very important. Patient will tell about these kind of side effects they have already. So alternative medications can be advised, which have a lower risk of stomach upsets. Proper hydration is very important. Plenty of water should be there. Drinking plenty of fluid throughout the day is very important to stay well hydrated and to avoid side effects of any other drugs. As I told you, spicy food or oily food should be avoided. Bland diets means some kind of toast, rice, bananas, and other digestible food should be advised to the patient to avoid dropout. Any drug like H2 blocker and proton pump inhibitor and any other drugs nowadays in market available, they should be prescribed with after consultation with clinician. What and it is very important to ask about side effects of and the severity of abdominal discomfort. Like if it is severe, patient may have complaint of persistent vomiting, dyspepsia. He may have black color stool that may shows gastric or duodenal ulcer, which may lead to bleeding, and that comes out in form of black stool, melena. These are the important red signs to avoid many more drugs and to consult doctor immediately. If you experience, there are some many kind of preparations are there of many drugs. Some work as a instant release and some work as a controlled release. So some medications are causing side effects in instant release pattern, but some medications that type of medications can be given controlled release form like metformin. Metformin causes abdominal discomfort very commonly. We can avoid in diabetic patient. We can avoid it in diabetic patient. We can avoid it by giving it sustained or controlled release form. As we all, it is very common in diabetic patient nowadays. It is incidence and prevalence of diabetes is high in India. Metformin is very commonly used. Metformin very commonly causes abdominal discomfort and dyspepsia and gaseous abdomen and distension. We can avoid it their side effect by giving it in controlled release form, not in instant release form. Now, in many more preparations are there in market in the combination or in single form. Metformin can be given in controlled release form, or we can use some over-the-counter drugs like H2 blocker and PPI to resolve these issues with metformin to avoid dropout of the patient to familial and to more concern about the metformin use. So that's all about drug and their side effect in the form of stomach discomfort.